Welcome to ETMC TV and this informative presentation by Bill Tobin, Radiology Director at East Texas Medical Center in Tyler. Mr. Tobin will discuss diagnostic imaging. Thank you for choosing ETMC TV.
I oversee the operations of the main hospital imaging department, the South Broadway imaging department, and the outpatient center and the outpatient building across from the hospital. The definition of MRI is magnetic resonance imaging. The way MRI works is that a large magnetic field, 25,000 times the pull of gravity, is applied to the body in different sequences, and on the cellular level it reverses the polarity of the cell. Once the magnet's shut off or manipulated, it gives off a radio frequency. That radio frequency generates an image. MRI is not radiation. MRI predominantly shows soft tissue, and it shows it well. Neurology is a big topic for MRI. CT will show bone, will show fluid, but not the detail MRI would on soft tissues. We've installed a new MRI, and it's a large bore MRI. Large bore means a larger opening for the patients to be scanned in. That helps with patients who may be claustrophobic. Patients who couldn't normally tolerate an MRI may well tolerate it in this larger bore MRI. It also comes with new technology, new coils, and new software that gives us excellent images. It's a little bit faster than the other MRIs because of the coil technology. We have an open MRI over at 5th Street. It's in an outpatient setting. We occasionally send an inpatient from the hospital when they can't tolerate the closed MRI. The open MRI allows a parent to almost actually get into the MRI with the patient because it's a flat MRI with the sides open, and you can access the patient that way. CT stands for computed tomography. The scanner revolves the X-ray tube around the patient to shoot multiple angles of an X-ray through that patient at different levels of the patient's body, kind of like a 3D picture or slicing through a part of the anatomy to look at it endwise. We have 2 CTs at the main hospital, and we have 1 CT at the outpatient center, and we have 1 CT at the South Broadway location. It's new technology, and it affords us speed and radiation safety. And we're reducing dose to the patient per exam anywhere from 20 to 60% radiation dose, and getting the same or better pictures with this new technology. Radiation dose is cumulative. That means whatever dose you receive at a young age, you carry through your life. So this reduced dose is very important for all patients, but primarily the most attention needs to be focused on the younger patient who has many years ahead of them to accumulate and have many more CTs over their lifetime. Contrast is necessary for some scans because some body parts do not visualize unless they're highlighted with contrast. Contrast is also known as dye by some people. And for patients who can't tolerate contrast or shouldn't have contrast because of kidney function, we can either reduce the amount of contrast we use or image without contrast in some cases. The technologist is always at the console when they're not in the room with the patient, and there's two-way radio communications between the patient and the technologist. They also place an emergency button in your hand that if you panic and you feel you can't tolerate and need to get out of that magnet, you press the button and the technologist will come right in and get you out of there. We have cameras on the inside of the magnet. We can watch the patient. We also put them on a pulse oximeter, a little clip-on for their finger that measures their oxygen while they're being scanned. And if we see that oxygen dip to too low a point to continue the scan, we'll stop the scan. We also have hooked up our systems to a sound system and the internet, so if you want sports radio, if you want country, we can accommodate. And you can listen to your favorite genre of music during the scan. If you're concerned, let us set you at ease and answer your questions. Technologists are trained to talk to patients, trained to calm patients, and we work very hard at it. Safety is our goal, and excellent images are our goal to help your doctor diagnose what your problem may be. So feel free to ask questions.
Bill Tobin is Radiology Director for East Texas Medical Center Imaging Facilities in Tyler. If you have questions about the advanced imaging and diagnostic services available at ETMC, please call 903-531-8200.